Hi and welcome to the back page, the Ashgrove Spinal Centre's weekly newsletter. You're watching this via YouTube, so please remember to click like because that helps other people find this post. Click subscribe because that helps you to find this post, remembering to click the notification bell. But most importantly, keep those excellent questions and comments coming in the comments section because that allows us to guide the content towards content that you want to hear. Thank you. Hi and welcome to the back page. Today we're going to be talking about disc injuries, specifically disc bulges. Now we talked last week and the week before, we touched on the three characteristics of a disc bulge. 1, back pain. 2, leg pain. And 3, pain in certain positions. To clarify, when we say back pain, it may be back pain, it may be higher in the back, may be lower in the back, may even be into the top of the buttock. Generally dull, can occasionally be sharp and maybe even catching, okay? So it might be dull all the time and then when you move, you get a little bit of a sharp pain. The leg pain typically radiates from the back and down the leg. It may go into the buttock, it may go down the thigh above the knee, although typically pain that's buttock and above the knee is often more related to other joints, maybe zygapophyseal, or facet joints, which is the word we use because it's easier to pronounce, quite frankly. But it will often shoot down the back of the leg, down through the back of the calf, may even go down into the foot. Pain on certain positions, many of us will have probably experienced this. Bending, twisting, maybe even straightening up after picking something up. So they're the 3 things to look out for when we're talking about a disc bulge. To put them into a little bit of perspective, 20% of disc injuries will symptomatically, and I mean the pain, they will remit, go away within about 2 weeks. So it may well be that there's not a lot of care that's required. A lot of people will be happy to sit those out, and that's an appropriate response. What I'd encourage people to be guarded about is whether or not, as a result of having that pain, you've started to change doing things. You may have started moving differently. You may have started to turn off some of the muscles that are important to structurally support your spine. That's actually really common and well worth checking. So whilst it may be that the pain's gone away, it may be worth looking at things. We often talk here of the 5 pillars, if you like, of care. I think of the 5 pillars as care, as restoring and encouraging mobility, promoting healing of the spine in this instance. 3 is addressing home and workplace ergonomics. 4 is exercise. That means a prescribed exercise routine, and there's not a lot of my patients these days who I don't prescribe an exercise routine to. That also extends to other exercise that you do beyond what I prescribe you. So that may be sport, it may even be walking the dog. And then finally, lifestyle factors associated with your back. And that can be a whole range of things, from smoking to your diet, all the way through to how you do back-related activities, such as taking the laundry out. So those 5 things, clearly, if you have back pain, it's responded within 2 weeks, it may well be worth coming in, just getting it checked out to make sure that everything is as it should be. And then I can also give you some great ergonomics advice and some exercise we can talk about, specific prescribed exercises. We can talk about the exercises you're doing and how we can make them a bit more back friendly. And then we can have a bit of a chat about your lifestyle and whether or not there are some little traps that you can address within your lifestyle to be back friendly. Gives you the opportunity to turn what could become a longer term problem into something that you nip in the bud very, very early. Moving on, The next category is where we have back pain, which may or may not refer into the leg. That's definitely worth getting looked at. So if you have all three of those, you have them for more than 2 weeks, then it's in your best interest to come in, because it's indicative of a disc injury. It's not happening for no reason, so it's well worth getting it looked at. Particularly if you have pain which is going down your leg, so back pain, pain down your leg, and then the pain going down your leg actually stays after the back pain. That's suggestive of a particularly resistant disc bulge, really. And that really does need some special attention, because for some reason or another, the characteristics of the bulge, where it's sitting, what it's come in contact with, are just not going to be conducive to healing and healing normally. Why do all these things happen? Well, as far as the back pain goes, just a quick talk about the innovation of the human lumbar disc. Most of it is innovated by what are called grey rami communicantes. You don't really need to know that. I think it's really cool. But I'm probably a bit of a spine nerd, and that's fine. That's why people come to see me about their backs. The characteristic of them is they're grey rami, they're autonomic, so they're not particularly myelinated. Myelination is just this fat that our nerves are covered on that protects them and allows them to be faster. So essentially these are they're sympathetic nerves, which probably sounds a bit silly because back pain is not particularly sympathetic, but they typically will produce low-grade, poorly localized feelings of pain. And that's because these nerves are much more commonly used in organs, okay? So they're much more used in, say, the tummy. So if you think about indigestion or tummy grumbling or hunger pains, that's a lot more of a closer cousin to the pain that you get with this low-grade diffuse back pain. There's also another nerve in there, which is, it's my favourite nerve in the whole body, called the sinuvertebral nerve. And the reason it's really cool is because it's myelinated, which means that it carries different information. And it specifically, well, this is me hypothesising, I suppose, I believe it can carry information that's more related to sharper sensations. Some people, they can tell me, they come in and they say, I was bending and I felt my back go. They tell me that they felt the moment where that little bit of annulus tore and a little bit of the bulge came out. And that's actually timely that I mentioned that, because I haven't actually talked a great deal about the structure of the disc. So we'll use the models. You can see we have model A. This is an anatomically perfect vertebral body and intervertebral disc. You can see that you have this nucleus in the middle. It's nothing like jam. So just these jam donut analogies, just forget about it. It's a bad analogy. It's almost as bad as discs slipping. That drives me mad. That's a different podcast. I'll rant on that significantly. But in any case, this is your disc. It's got all sorts of goodies, proteoglycans. It spends all its time trying to absorb fluid and swelling up. Around it is the annulus. So the annulus fibrosus. You can see it's all of these rings of ligaments. And what happens as the disc breaks down, which can be a normal process of degeneration, it can happen faster in some than others, which is always a little bit unfortunate. But if I put item A versus B, which is the second stage of degeneration, you can see that we've actually lost some disc height. That's indicative, if I turn it around, you can see here that you actually have breakdown in these annular fibers. So as that happens, the disc loses a bit of height and it commonly bulges. So you'll often hear people say, oh, I've got a bulging disc or bulging in my discs. Bulging in the disc is not always a big problem because it can be a normal process of degeneration. But if it bulges, particularly if it's bulging because there's some nucleus pushing it and hits one of the nerves as they're trying to go about their business in the body, that can become a real problem. So what are the consequences of this breakdown? We get this bulging, we then end up with this loss of disc height and this damage in the disc itself, is the disc becomes a little bit unstable, and we think that's probably one of the reasons why we can end up with pain on certain movements, because the disc's not as stable as it used to be. And that means that normal movements, particularly if it's painful and inflamed, can produce the experience that we call pain. So the body responds by creating this degeneration. If we look at the third model, you can see from the disc it's significantly changed on the inside, but it starts to produce these bony spurs. So it essentially calcifies outer fibers of the disc's ligaments to try to stabilize it, because it wasn't stable beforehand. So that's a little crash course. I'll talk more about this as we move through. To be honest, what I'd love would be comments on the video. If you have questions, please ask them. I love answering questions on the spine. I've taught anatomy for, almost 20 years. I'm not in an active teaching role at the moment, and I suppose I'm probably a little bit of a frustrated teacher. So yeah, please, you'd be doing me a tremendous favour if you'd ask me questions in the comments section, whether you're watching via Facebook or YouTube. So I think that's probably a pretty reasonable summary. We try to keep these brief. In summary, characteristics of a disc injury or bulge: back pain, leg pain, pain on certain movements. In terms of how they categorise out there, they may remit within 2 weeks. In that case, you probably don't need a lot of treatment, but I suspect you probably do need some advice on how to address factors that may not be ideal for your back. And if you do have back pain that persists for more than 2 weeks, particularly if you have low back pain, leg pain, and pain on certain positions, then definitely come in so we can assess whether it is in fact actually a disc, which it most likely is, and then we can put in place the appropriate care plan for you. Thank you.